last part of our bacteria class, Enterobacter class, which is Enterobacteriaceae. So as you are watching in the clinical case, I have already written EHEC. Let's identify why it's EHEC. So if you'll just pause the video and read through it, the clinical case. So the first symptom appears is abdominal pain. Then there is watery diarrhea. This is the main hint we can use, that watery diarrhea. And then small amount of visible blood with this tool, so it actually identify more precisely that it could be EHEC. And here there is another most important is the patient ate hamburger in the fast food cafeteria. So as I have said, that if a patient is eating more roadside food, which is fast food, so and this is the main reason that okay, fast food, then she must having in bacterial infection from the E. coli. And another thing you might ask, the girl didn't have any vomiting in any part of the disease, so this actually rules out the salmonella, because in the salmonella it causes enterocolitis, which is food poisoning, and as a result patient will experience vomiting, so we can rule out salmonella. So we can just read through it, the questions. And transmission and the treatment, I already discussed it in the first part of the bacteria, which was the features and treatments and transmission of the bacteria. So let's go to the clinical case 2, which is about Salmonella enterica. Here, if you just pause the video and read the case, here you can see that the patient has really low grade fever, abdominal cramps, vomiting and diarrhea. So as I have said, I have written a table about the clinical symptoms of each bacteria. So you will find that the patient is having low grade fever, and also patient is experiencing vomiting, and as a food, the patient ate chicken approximately 1 day before in the Christmas dinner. So this is more likely to be salmonella, because in the transmission process we actually studied there that the salmonella will transmit through the carrier, milk, eggs, and the main is chicken meats if it's raw or made raw. So you just can read through these questions and can answer by watching the first part of the video. Here the questions, and here there is another clinical case for the Yersinia enterocolitica. Here you can just pause the video again and just read the case, but I will highlight the main cause. Here we can see the low grade fever, and the girl is visiting her grandparents, domestic animals, which could be rodents, and they use home cured meat, fresh raw milk. So there is huge possibility that is Yersinia. And here you can see that they had low fever here, 25 to 30 degrees Celsius, and also you can see as they went to the farm, here there is must that they will come contact with the soil there, and the animals could be infected. So there is huge possibility that the bacteria will be Yersinia. But even though we need to cultivate those bacteria in the lab and just wait for the reports here. And then the last case, this is our last case, which is for Salmonella typhi. How we will be able to identify? Here the patient has vaccinated in India, and the patient has 3 days of fever, which is not normal. It's high grade fever. And we need to know one more thing, that in the clinical cases chart I said, like salmonella bacteria will cause low type bacteria, and shigella will cause high level of fever, not bacteria, high level of fever. But only in case of Salmonella typhi it will cause high grade fever if the patient is affected with Salmonella typhi. And also patient is having chills, headache, abdominal pain, and also weakness. And here he ate local foods, again street food, salmonella, easy to get it. And also he didn't get any kind of travel related vaccines, so it directly says that this is Salmonella typhi. And you can read these questions and just answer it by watching the first part of the video, because I have discussed a lot about Salmonella and how it's transmitted, how it can be prevented, and how the symptoms will occur. And I also have written the stages of the typhoid fever. So at the very first stage of the salmonella, there will be Salmonella typhi, there will be high fever, which is 40.1 degree. It could go to that level as well, so we need to identify that this could be Salmonella typhi. But even though we need to diagnose the bacteria, we need to take the sample, then do the transport to the lab, and then do the cultivation, and then also last part is identification. So I hope you guys will like my videos. It's a bit long, about 1 hour, but I promise that you will benefit a lot from this video. So just watch the video and just take a paper and take some notes, or make some flashcards in the Anki, and you will be able to like crash the bacteria and we will be able to identify. So wish you good luck, and also let me know in the comment section if you like this video or not, and what to improve or not. Thank you.